Hi everybody, Dr. Suneel Dhand, internal medicine physician. 10 countries so far have taken up about 80% of the world's COVID-19 vaccines, and these countries are not necessarily the most populated countries. I also read a statistic that under 1% of the world's poor has even been offered a COVID-19 vaccine yet. And when we think about the fact that COVID-19 has spread all over the world, there's literally not a country that has been spared from it. You think of all the millions and millions of vulnerable people out there who haven't yet received the COVID-19 vaccine. That is truly something to think about. And last week, of course, I talked about the fact that in Western countries, we are debating vaccinating children. This obviously varies enormously by country, but there's many medical authorities out there that have raised the point that Western countries shouldn't even be thinking of vaccinating healthy 12-year-olds who are in a low-risk group when there are these millions of people all over the world who are still as yet unprotected. Who are these at-risk groups then? Well, hopefully you know these by now. I'm going to tell you based on my own experiences as a doctor at the front lines who has worked in multiple different hospitals. I've worked in different regions of the United States, probably treated hundreds of COVID-19 patients. This is also my own observation, but backed up by the broader data. Number one is the older population. Now we know that with each passing year of adulthood, the immune system tends to weaken. Obviously this varies enormously by person, but in general that's the rule, with children having the strongest immune systems. And with regards to the actual age cutoff, in the West we tend to apply an age cutoff of 65 and over as defining an older person. I can tell you, however, though, that, again, this is highly individual. I even see a lot of 50-year-olds who have dramatically increased risk factor profiles, whether that's because their HbA1c, which is a marker of blood glucose control, starts creeping up, or their cholesterol is going up as well. It really does vary. But in general, the cutoff we have in the West for an older person is age 65 and older for being higher risk for COVID-19. Number two is anyone with chronic comorbidities. Now, there are a whole host of chronic diseases for which people take medicines for, which would put them at risk for a worse case of COVID-19. Heart disease, lung disease, many other chronic conditions. But the two in particular that I would like to focus on here are diabetes and lung disease. Lung disease, whether that's chronic airways disease, COPD, or asthma, obviously puts people in a higher risk group because COVID-19 primarily affects the lungs. Number three is anyone who is overweight or obese. I would say that this is the one aspect which hasn't been talked about anywhere nearly enough during the last 15-16 months, and it's ironic because it's the one factor which is in our control. I would say that in my experience, this is probably the number one risk factor for a younger person being hospitalized with COVID-19. And we know from the research that having excess body fat places an unnatural stress on the lungs and can also act as an immune suppressant. Those three groups then are the ones who I would like to see prioritized for COVID-19 vaccines all across the rest of the world, seeing as so few countries so far have even started significant vaccination programs. In medical school, one of the first things we learn is to risk stratify people. We seem to have forgotten this, but a 16-year-old is not the same as an 85-year-old. And one area as well where I differ slightly from some of my peers is that for me, the practice of medicine will always be about human beings, about individuals. And no two people are the same, and everybody's body is different. I don't believe in treating human beings like cattle. If there's anyone out there who has any particular concerns, I think that they deserve to be talked to by their doctor, human being to human being, one-on-one. That's the least we can do. Remember, COVID-19 is very new and a lot of people have their own unique concerns. We owe it to our patients as a medical profession to show compassion and empathy here. And it's totally okay as the medical profession to sometimes say when we're not sure about something. And in fact, I think we earn more respect when we do that. It's not good to be adopting extreme positions. And I feel like when we do that, we tend to alienate people even more. And this is so true. And I wish our medical authorities actually noted this more, that when you adopt these extreme positions, it tends to serve counter to the goal that you have in mind in the first place. Any medical decision has to be approached with compassion and empathy, and individuals deserve to be treated with respect. I don't believe in pressure, and certainly not coercion, unless it's an absolute imminent life or death situation with any medical decision. And to be honest, I'm not a big fan of mandates either. Everybody deserves the right to talk with their physician about individual risks and benefits, especially if they're in other groups. Like, I can think of some situations, people with autoimmune disease, many of whom have had concerns and talked with their own doctors, people who are very sensitive to medications, people who've had side effects to, say, the first shot. Do they go ahead and receive the second shot? These are all discussions to be held between patients and their doctor. And I've already talked about in previous videos people who've recently recovered from COVID-19 or have high levels of antibodies. These are all areas which we're learning more about all the time. Every medical decision out there is a benefit versus risk decision. You can pass everything till the cows come home, but that is the core of any medical decision. If the benefits outweigh the risks, you go ahead. If there's any doubt about that, then you tend to hold off. That is what everything boils down to, and we seem to forget that a lot of the time as well. I can think even within my own family, actually. I have a family member, close family member right now, who is actually pregnant, and she spoke with her doctor and they decided that in her unique circumstance, it was right to hold off the vaccine. I have another family member who has a history of blood clots, and she had a discussion with her doctor and they decided to hold off for now. At the opposite end of the spectrum, I have a relative who was kind of on the fence, and I sat down with him, and unfortunately he knows this. He hasn't been taking care of himself over the last few years. He's gained a bit of weight, he's getting older, and he also works in a job where he has lots of interaction with people from different regions of the world. And I told him that he is exactly the kind of risk factor profile that I see show up in the emergency room with a bad case of COVID-19. He went ahead and got the COVID-19 vaccine and he's fine now, he's back at work. Getting back then to the main point of this video, there are millions of people all over the world in these at-risk vulnerable groups who are still as yet unprotected. Their countries have barely rolled out any type of vaccination program. It should be a priority to protect these people first. Thanks everyone for listening. Dr. Suneel Dhand. Follow me on YouTube and Facebook, MedStoic Lifestyle Medicine. We'll speak again soon.